how do probiotics and other gut health supplements really fit into the picture of supporting healthy digestion in young children, in your opinion, Dr. Korczak? I mean, are there places to go? Actually, before we get into that, places to go, resources and so forth, what does the literature say?
Yeah, well, I think, as a good scientist, you look at the good, the bad, and there's a lot of inconsistencies sometimes in publications, right? So I think probiotics certainly do have a place. I always think about, what's the condition or what's the symptom that we're trying to help a child with? Is it diarrhea? Is it constipation? Are they having occasional constipation versus something that's more chronic? What's the problem? Because that's why I think the strain, the specificity of the probiotic really matters. Not all strains may be appropriate depending on what they are going through. So that's where I think the literature really, has to better tease out and make kind of recommendations towards, like, my kid has diarrhea. Okay, this is efficacious. And we know there have been studies, a lot of them with mixed results, right? We know of things like Lactobacillus rhamnosus. There is some efficacy for things like diarrhea and or constipation, but it's dose, it's form, it's, the type of population that the research was studied in. But certainly I think they do have a place. I'm a big fan of kind of making sure they also have prebiotics in their diet for the probiotic to work, right? Because they're like a dynamic duo.
No, they're twins.
Yeah, they're twins, right? You need the food substrate from the pre to kind of naturally feed the pro.
Right, absolutely. And I'm biased as a Canadian, because this is a Canadian publication, but this is just driving home your point. So no such thing as the best probiotic.
Right.
We'll talk momentarily actually about what Dr. Murray has developed, because I think that's incredible. The whole Child Life line is incredible, but select probiotics to confer specific health benefits as well as broad health benefits. But here's an example, the probioticchart.ca, and as I mentioned, it's Canadian. But to click on pediatric health and to see all of the different products, but more importantly, the strains and species that are used, and then the applications that are, of course, then evidence-based through the research. So antibiotic-associated diarrhea, the probiotic for that's going to be different than the probiotic for colic. Then it's going to be different than the probiotic studied for constipation. So Dr. Murray, tell us why you formulated with what you formulated in the infant drops, because there's two select strains in there that confer health benefit.
Probably the most researched one is the Bifidobacterium longum for infants, within that first year. So that would be the one I would focus on. This is why we used it in this product. But in terms of just, across the board and for that age group, that seems to be the most well-researched.
And in the literature, in your opinion, Dr. Korczak, are there best fibers that support the diversity? Because there's all kinds of types. You've written numerous publications. Here's one of them in 2017 Nutrition Reviews, Dietary Fiber, Digestive Health in Children. What did you find here?
Yeah, so this is a little bit of an older paper, but I think, again, we were trying to really answer some questions that we were getting not only in our lab, but also for, in preparation for a clinical trial we were doing. And we wanted to just kind of do, a landscape overview and figure out, are there prebiotic fibers? Are there whole food sources we should be looking at? But for prebiotics particularly, actually PHGG rose to the top. So that's partially hydrolyzed guar gum. This is one that's kind of isolated from guar seed. It's kind of, the fermentation profile is very gradual. It's generally well tolerated. So this is one that was actually pretty good for kids. Again, there is some mixed research, but that one, I would say is, there is some evidence there. There's also some data on glucomannan, and the rest being more on whole grain sources of dietary fiber. But when you're looking just at a prebiotic, and PHGG is soluble, so we know it ferments. We know that it'll feed, the bacteria that exist in the gut. So.
Right, and talk about it being like, safety. So there's got to be safety, efficacy there. But this is, again, this is partially hydrolyzed guar, right? This is soluble. It's tasteless, odorless. You can pretty much hide it in your kid's formula if you wanted to, right? Which, by the way, what are the statistics around deficiency of fiber, the soluble type, in children? Because I know, moms and listening at home, dads too, try to feed kids more fruits and vegetables and so forth. But can we really ascertain the daily requirements of soluble fiber that feed the good bacteria with our diet alone? Or do we kind of really need to think about supplementing our children, infants, toddlers with this soluble fiber stuff?
Such a tough question to answer, but I'm glad you're asking it because, I think parents deserve answers. I was refreshing myself on even some of the medical recommendations by these larger societies, and they don't actually even acknowledge that fiber supplements, should be included for things like constipation, or that they're efficacious. However, they do agree that children, adolescents, and adults definitely do not get enough fiber in their diet, right? So it's kind of like we see this mixed evidence. If you look at average intakes in kids, it's actually very poorly documented. We know they're not getting enough. Adults on average only get about 16 grams of fiber a day. Recommendations are between 25 to 38 grams for men and women. So we're barely halfway there. For kids, I think we need better studies to be able to capture average intake levels, because there are very few studies from what I've seen.
So in a big perspective, and you can address this, is that as we have shifted away from a food plant-based diet, meaning homegrown, straight from the field, straight from the farm.
Yeah.
And as soon as we start processing foods, we lose that fiber, right? So a huge shift occurred in the last 30, 40 years also in the food industry, where we've moved from a fiber-based diet to a non-fiber, processed food diet. So perhaps that's a bigger wave that's occurred behind the scenes.
Yeah, and I think, there's ways to get fiber in your diet from natural plant-based sources, but there's families who buy packaged foods, right? So I think there's no perfect answer here. It's kind of meeting people where they're at, and giving them the education they need to be able to make the best choices possible. So something as simple as, when they're purchasing a packaged food, look at the nutrition facts label, look at the daily value for fiber. I always tell clients, consumers, aim 20% or more, because that's considered high. We know the daily value for fiber is 28 grams a day. If it's high in fiber, you're getting, close to 6 grams at least in whatever you just purchased.